Hello everyone. My speech is about PCOS, which is polycystic ovarian syndrome. And what PCOS is a syndrome with three main features, which are cysts in the ovaries, high levels of male hormones, and irregular or missed periods. Polycystic means many cysts. PCOS has many small fluid-filled sacs that grow in ovaries. According to Watson, an Italian physician, Antonio Baisneri, first described its symptoms in 1721. Here's a picture of an ovary. This one doesn't have cysts. This one does. This one has many cysts here lined inside of the ovary. The way you diagnose PCOS is, of course, you go to your physician. The physician does run many exams, which includes a pelvic exam. They also do an ultrasound, and they do a blood test, which all work together to come to the conclusion of PCOS. The doctors also do ask, according to Watson, symptoms like acne, if the patient has a lot of acne, face and body hair growth, and weight gain. Sometimes when you do have PCOS, look at this picture here. This, of course, is someone that's obese, a lot of acne, facial hair, even hair loss, and irregular menses. This lady, of course, is dealing with that, but the way you, of course, start feeling that you might also have PCOS is, as a woman, your menstrual cycles are irregular. Sometimes you miss them completely, months at a time. So those are signs to watch out for, and of course reach out to a doctor, to a physician, and let them know what symptoms you're receiving and experiencing. And some of the treatments that are available for PCOS, according to Lucidi, certain lifestyle changes like dieting and exercising, those are some of the first line treatments that a lot of people do turn to before they turn to any kind of medication. Some of the medications that are available for PCOS is metformin. Metformin is a diabetic medication. Doesn't mean you're diabetic, but it does actually help with your insulin levels, which could be really high according to your PCOS symptoms. And then there is clomiphene, which is Clomid is short for clomiphene, which does help you ovulate. That's if you're trying to conceive a baby. There's also spironolactone, which is a water pill, and that does also help with your insulin level. And then birth control pills, that's if you're not trying to conceive, that does help you with your hormones, leveling them and trying to get them under control. And some of these medications, of course, you do have to have a physician prescribe them. And then for fertility purposes, if you do want to conceive a baby, there's medications to stimulate your ovaries and help you ovulate, which one of the main pills, medications, is Clomid. That's the most common fertility drug used. Then there's Femira, which is also letrozole. That's an alternative for Clomid that also helps you ovulate. And then there's gonadotropins. It's an injectable drug. That's the strongest ovulation stimulating drug, and that does actually help you ovulate. And that's right here for this one. This picture down here, it actually shows the PCOS facts and numbers. I know it's backwards, but there's a 50 to 70% have hirsutism. 50% of women are diagnosed with PCOS. 5 to 10% women of reproductive age have PCOS. 30 to 75% are obese or overweight. 50 to 70% have insulin resistance. Those are all symptoms of PCOS. Thank you.